Welcome to another episode of Health Matters with Physician's Assistant Lynn Szabo. What are we going to talk about today, Lynn?
We're going to talk about me as a patient.
Uh-oh.
And yeah, I know. That's what my whole team said.
Oh, no.
So I had on July 22nd a triple arthrodesis on my right ankle and foot. And what that is partial bone fusing, a lot of scary looking hardware. And the hope is to rebuild my arch so that when I walk, my ankle doesn't collapse in my ankle and now knee are not collapsing inward toward my body, the central part of my body.
Ouch.
So I'm currently on no weight bearing, which is a super hassle, but I have this really cool knee scooter and I can pop a wheelie like nobody's business.
Can we go to the pump track after this?
Yeah, I think we should totally get into some trouble.
I'm all for it.
Yeah, and I'm currently on medical disability, which is why people might miss me from the clinic.
Oh, okay.
So I had what I found was interesting.
Wait, you took time off?
I know, hard to believe. Complete time off.
Wow.
I know. And, you know...
You're not working from home secretly? You actually took time off?
I actually took time off, and then thank you to my colleagues. There's a couple of travelers covering me at Crescent City UHS, and then also my favorite doctor at Del Norte Community Health Center, Dr. Gordon. Kenyatta Gordon is covering me on the infamous acute care clinic, the No Rules Clinic.
The No Rules Clinic. I need to go stop by there just for fun one day.
Yeah, it's cool. It's where the happening chicks are. So I'm
not welcome.
So what I found initially that was funny, this is my journey as a patient, okay, is that my team, including my daughters who are my caretakers, one of my youngest daughter is a nurse, actually works on med-surg back east, and the two PAs who have taken care of me and my PA co-side and the surgeon and then all the nurses were really good at coming to me and saying that I needed, individually, by the way, I needed to commit to being a patient and not a provider.
And did you make that commitment?
I did, with one small little exception. They allowed me to speak in medical jargon.
They allowed you to...
Which is way more efficient when medical people are speaking together.
Gotcha. And have you kept that commitment?
I have.
So far?
Yes.
And it's been how long? 2 weeks, 3 weeks?
2.5 weeks.
How many more do you have to go?
7.5.
So there's still time, Lynn.
There's still time. And I will tell you that I have kept that commitment, that it has not been easy, but really providers make terrible patients, and providers in my life and the times that I've had other surgeries and then also having my kids, it's really better if you check out as the provider and just let qualified people take care of you. And luckily, my two daughters stepped up to the plate, and I have found the Del Norte community to be super supportive. People checking in on me, people making sure that I'm not going crazy.
You are truly loved, Lynn.
I
by the community.
That, and I'm humbled by that, actually. But I can hardly wait to get back and just crank up the clinic scene again. So my surgeon was Dr. Richard Owens from Southern Oregon Orthopedics, and he is their foot and ankle guy. And I think he's their only foot and ankle guy.
Oh.
And he is a rock star.
He really loves feet.
Yeah, and that's not common in a medical procedure.
It's common in society as a whole, Lynn.
Patients know that oftentimes they'll come in with a complaint of foot pain and nobody ever looks at their foot. And
nobody likes feet, Lynn.
Nobody likes feet. I think I have a new respect for feet, so I tend to look at them because foundationally, that's how you get around, right? So it's kind of important.
That is how we get around.
Yeah. A portion of my perioperative care was from his two PAs, who are Andrew Del Carlo and Nicola Heminger. And they are young and they are bright and they know orthopedics and they're excited about feet, and they were super helpful, and especially allowing me to speak to them in our language.
Oh, nice. So the up-and-coming PAs, you feel comfortable? One day you might be able to retire. You'll trust them with the care of the community?
Yeah, these two, these two are great. They're working with a great surgeon. So Dr. Eugene Stead, the person who started my profession, would be proud. So they're comfortable and they are competent and they are top notch. And they also even had a cast technician there who fitted me for my purple and black kind of goth-like cast.
It is a super cool cast.
Currently have on up to my knee. And she was well trained. She's a medical assistant who stepped up and had special in-house training on it, and she does a great job. Lower extremity casts are hard to do, and she was awesome.
It really is.
Yeah. My surgery was at Asante. That kind of makes sense. In Medford.
Okay.
And they were great too. But the things to remember when you're the patient, and these are important for us coast dwellers. Medicine is now way big on the computers, and no matter how many times you try and dodge that, they really want you to be their unpaid data entry clerk. So resistance is futile. I really resisted because I am computer competent. People make the assumption I'm not, but
Well, no, you work in the medical field. Everything is in computers.
I'm computer averse, and I don't want to spend my spare time like doing computers.
Gotcha.
So, but I don't think you can say, no, thank you, I don't want to sign into the patient portal. And then 10 minutes, they'll ask you again. And you say, no, thank you, I'm not really interested in that. 10 minutes, it'll come up again. So I finally just crashed. It took me like an hour. I did it on my phone from home. And I must have been really bored.
You would rather go to the office and fill out an hour's worth of paperwork prior to surgery than doing it from home?
Actually, paper with pen, I can zip through more quickly.
Okay.
Yeah, I'm faster on paper.
Gotcha.
The whole world is
So you're not a
faster.
total Luddite, you're just have your preferences. What you're
Yeah.
comfortable with.
Yeah.
Okay.
So, but weirdly, even though they don't like paper, they're really focused on two important pieces of paper, and that's your ID and your insurance card. Make sure you have them, because it would make sense, I think, to drive from the coast, maybe be in a hurry and actually forget those two important pieces of paper.
Yeah, somebody else is driving you and they have it on
Right.
file, right?
Right.
They have your insurance card on file, or they wouldn't have been treating you
Well,
prior to surgery.
They have copied my insurance card about a total of 8 times, the same insurance card.
Jeez.
So I don't know why, but it seems like it's important.
The computer doesn't like you back, Lynn.
Yeah. And the ID is because you have to prove who you are, because they're not going to be doing surgery on somebody who isn't who they think it is. So
So they don't
I have
do ankle surgery on somebody who needs a knee surgery or amputate somebody's.
No, it's not their mistake. It would be more like insurance fraud. Like I have
Oh.
seen in my career where somebody shows up in clinic trying to get care, and they're representing somebody else.
Wow. That they're just that desperate for care.
Right.
So they commit
Yeah.
insurance fraud. So this is that.
So they're texting somebody back and forth in the parking lot to answer questions.
Okay.
Yeah.
So if we had universal health care, would that take care of that issue?
I think that would solve that problem. What an amazing bright star you are to suggest it. Is healthcare a right or a privilege?
It's a right.
It's a
Everybody has the
right.
right to health care.
Yeah.
I'm glad we're solving the world's problems
I
today.
know. If only we were in charge. So, the other tool that people as coast dwellers should be aware of is that Asante has 2 patient hospitality houses that are very near their hospitals. There's one in Medford and one in Grants Pass. The
A
one in-
hospitality, like the Cheney House or Ronald McDonald House kind of a thing?
Yeah, that's
Okay.
exactly what they are. Ronald McDonald for adults. So I stayed at the Francis Cheney Family Place in Medford. The other one's called the Family Place, and that's in Grants Pass.
Okay.
I only stayed the night before, but I made reservations for 2 nights in case, there was a complication that meant my non-medical driver shouldn't be driving me over the hill.
Okay.
So it was only $50 for one night, which is way cheaper than most of the motels in the area.
That is. Did you know that with the hotels around the hospital, that if you tell them you're there for surgery and provide your information, they'll actually give you a discount? It's still more than $50, but they'll
Right.
give you a discount on your stay.
Right. Well, that's good to know, too.
Yeah.
I didn't know that. It was clean. It was safe. It was beautifully kept, and it was organized. It was a little bit like going home to your mom's house. because there was a lot of rules, but none of them were, you know,
Like bizarre
weird.
rules or just rules?
Like they want you to clean the room before you leave. You know?
Well, for $50, they're not actually making enough money to pay somebody to do that, right? So it kind of,
Right.
I
I
gotcha.
went with it. And a lovely volunteer helped me out with a tour. Like they don't want you to eat in your room. They want you to eat in their kitchen and you know,
Okay.
it's stuff
So it
like
is
that.
like moving back in with mom.
Yeah, it was cute. There weren't any little candy dishes though. Like
That'd be moving in with grandma.
but they were lovely and I would highly recommend it if somebody has a surgery where they, you know, maybe the weather turns or something like that. And
Okay.
they need a place to stay for not very many bucks.
Okay.
So all of the medical facilities in Medford don't really understand the challenges of travel to and from the coast. They kind of get it intellectually, but they don't really put it into action when you're trying to make follow-up appointments or things like that. So make sure they know you're coming from Crescent City and that your follow-up care needs to be scheduled with that in mind. You know, they were as soon as I said I'm coming from Crescent City, then they tended not to, you know, take two appointments and make them in 2 consecutive days instead of be able to do them both on the same day.
Okay.
Stuff like that. So let them know, but they're really understanding once they know that you're from far away. They're understanding about the challenges that the road presents. I was actually 20 minutes late for my first post-operative follow-up appointment, and I hear, you know, you can't be late really.
No.
You know, at UHS you can be 10 minutes late. At Del Norte Community Health Center, there's talk about you can't even be a minute late.
I was going to say you have to show up 10 minutes early for your appointment or you don't have an appointment. But I don't know that that's policy, but yeah, you're asked if your appointment's at 8:30, they ask you to be there to check in by 8:20.
Yeah, they're discussing policy that you have to be there right at the time of your appointment, and there's no room for error.
In all fairness, they do bring you back when your appointment time is.
Well, that's good. They brought me back,
Yeah.
but I was 20 minutes late, and they're like, "Yeah, no problem." And I thought, oh my God, they're going to make me go back. You know, I'm not going to have a ride because I can't drive, and right now, and you know, I'm so sorry, and they're like, "Yeah, no big deal."
Do you think they just expect that, like you're a Del Norte, that's what you do? Or
Right. There maybe my name's in red or something. I don't know.
it's because everybody loves you, Lynn. They know if they turned you away, the community would come after them with pitchforks.
Yeah, maybe. So I was 20 minutes late, not turned away. That I think was really helpful. Asante, as a hospital, super efficient, especially with the nursing staff. They were on point and they were open to answering questions. So it's not like they definitely were on a schedule. They were trying to do things in an anticipated time frame, but she always had a moment to answer a question if I had it. I am really comfortable in medical surroundings. I don't ask very many questions because I kind of
No, what's going to happen? Yeah.
And my daughter, who's the nurse, was with me, and she didn't, you know, things were going as we would have expected, so we didn't ask a lot. But she was businesslike and kind and got me to surgery well within time.
Do you mind if I ask what questions you did have? I mean, as a provider, I would think you would have no questions because you know everything, but you clearly had questions. Do you mind sharing those?
Let's see, what questions did I have? Now, remember, I was given drugs, and I don't remember a lot of it.
Okay.
But, you know, I think it was mostly about where do I get a knee scooter, because I really was not doing well on the walker.
Gotcha.
And I had already tried out crutches, and I have to be non-weight bearing on my right foot and ankle, and so that wasn't really working for me. So they kind of turned me on to where to find a knee scooter and how to use it.
Okay, so that makes sense.
Yeah. Anesthesiologist was also very present and helpful, and she was talking to me in medical anatomical terms, which I appreciated. Because at this point, I think that they kind of slide you a little bit of stuff for nerves and stuff. That's all part of their protocol. And I was feeling a little loopy at this point. But so it was good that she was responding to me in language that's my native language, really. So I appreciated that. And then I just left the driving to them. And all of a sudden, I woke up in post-op.
Wow.
I was like right where I started, kind of with the initial nurse, and it was all over. And my daughter had talked to the surgeon. I have no memory of actually ever seeing him. And had, was glaring at me, non-weight-bearing mother. Non-weight.
I wonder why they had to tell you so many times.
I know. And the physical therapist came in and helped me and gave me some pointers with the walker and with crutches and made sure that I could go up and down a low stair and stuff.
So even non-weight bearing, you were getting physical therapy right after surgery so that you could maneuver safely.
I wasn't even fully awake yet.
Wow.
Yeah. So wasn't very good at it. So the knee scooter became my preferred method of mobility.
And you find that to be easier both than crutches and a walker.
Yeah, and it's got a certain cool.
It is pretty cool, I have to admit.
Cool.
I'm serious about the pump track, though, after we're done recording this.
Yeah, I kind of feel like it's 1968 and I have my candy apple red Stingray. And I'm off and running.
If you don't immediately get the picture of that in your head, you need to Google that. I'm just saying, Google photo images, Google that.
Yeah, that was the height of cool in 1968 when you were 10 years old.
I wasn't even alive then, so technically, but I know exactly what that is.
I was 10, so enjoyed it. I got to say a lot of good things about Southern Oregon Orthopedics in Medford. They have a large office building, which is bigger than it's kind of the size of the new dorm building in Arcata. It looks like, God sent down a square of orthopedic resources for all of us.
Thank you, God.
I know. Can you nudge it a little closer to the coast, maybe?
I was going to say, can you drop some resources here in Del Norte County? Is it because we don't have enough public land available?
I don't think we have the press of patients, although all of our patients here need care. So
that's true.
But
can God drop down universal health care on us? I mean, if he's going to give Medford an orthopedic center, can he just drop down universal care for America?
This PA is still hoping and praying.
Okay.
So, it has actually. When I walked in I had 2 preoperative appointments. The first one I walked in, I was in tears. It was kind of like what immigrants from Africa tell me they feel like when they get to the typical grocery store in the United States. It's so many different choices and so many different resources that it's completely overwhelming.
So as a provider in Del Norte County, you were overwhelmed at the services available to you in Medford.
I was overwhelmed, and I'm everybody that I interacted with, including the physician, I was like, thank you so much for having this here. Thank you for taking care of my patients. And my surgeon, and I've got tears in my eyes, okay? And my surgeon puts his hand over his heart and says, it is my honor.
Aww.
And I can't tell you how much that meant to me. That now I know I can send people there, and I think they do accept partnership. There's increasing availability of partnership in Southern Oregon.
There is.
They finally figured it out.
Yeah.
So that we can't be trapped here with no resources.
Yeah, you can get eye surgery there, I think a knee replacement, see the cardiologist if you're on partnership.
Mm-hmm. So this single large office building has, it's 2 levels actually, has an elevator, which I found useful later on, but I did the stairs.
You weren't doing wheelies at that point?
I know.
Okay.
So they have their own physical therapy department with people who have PhDs in physical therapy.
Wow.
Which is kind of amazing. They have their own in-house X-ray with X-ray technologists and in-house reads, which I think is amazing.
What do you mean in-house reads? Is that like reading X-rays and things?
I think they have a remote rad read, which means radiology read, but I also think that most of the doctors and the PAs, one nurse practitioner, actually read their own X-rays.
Oh, wow.
Yeah, That's super good. And they'll show you your x-ray that you just had taken 5 minutes before in the exam room on the computer. And they'll say, look at this, and this is important. And, oh, good, this looks good.
Yeah, somebody's always been good about sharing their images when they get things, even when they do the heart scans and things.
Right. Yeah, we can't really do that at UHS right now, but we're coming to Epic in October, and I think that'll be easier to do.
That'll be really helpful.
Yeah, that will be. And they have a huge staff of MDs and PAs with one nurse practitioner, and they've got the knee guy and they've got the hip guy, and Dr. Owens is the foot and ankle guy, and I don't know that they have a spine guy, although I wouldn't be surprised because that's a need. They seem to answer the need with very focused quality care, but all needs are covered.
Oh, wow.
You see what I mean?
Yeah.
So you're not, in an underserved community, we're so used to generalized care, which is not necessarily a problem, but this is super specialized care.
Yeah, the problem isn't in the compassion and of our providers or in their dedication to serving us. It's in their ability to do so. If you have a child born here and there is the smallest possibility that they may need assisted in breathing, you have to fly them to Medford because we don't have the things on hand to assist a baby that small with breathing or whatever the issue is. You break your leg, we don't have an orthopedic to set it here. You have to be flown out.
Right.
Heart attacks, strokes.
Right.
It's not the lack of compassion people have, it's just the ability.
Yeah, we kind of have a critical access hospital without really officially having a critical access hospital.
Right, I just call it a triage center. If there's something serious with you, we'll know, they'll fly you out.
Right.
Yeah.
Right.
I'm not harping on our hospital. I'm just,
no, not at all. But
we don't have the ability.
Yeah, rural healthcare. The providers and the staff in rural healthcare are jack of all trades. They have to be, and
they've learned to be a Del Norder and Del Nord it too.
Yeah, and sometimes you need something a little more, and you get sent off to another location.
Yeah.
So, they are pleasant to me, although.
Who could not be pleasant to you, Lynn? You're
Yeah.
delightful.
Well, I was speaking their language. They kind of like that, I think. They are organized. There are no big lines to wait for something. And it's a dream to focus on what can be or what needs to be done instead of what cannot be done.
Say that again.
That's a huge, big foundational thing. It's important. Here, I think oftentimes the first things out of a provider's mouth is, we can't do that, we can't do that, we don't do that here, we can't do that. And there, it's not like that. It's like, we can do that. 20 minutes late, no problem. You can't find a knee scooter, I'm on it. So they had more solutions that they presented to me than problems that they gave me to solve.
Wow.
I know. I was in tears the first appointment there because it was like looking at the most beautiful work of art in the world and understanding why it was so beautiful.
Their ability to specialize care and help their patients right there.
And they're so all cool about it, and they're all kind of youngish, like late 20s, early 30s, and they're all wearing Patagonia or Patagucci, as my girls say, and they're all like, doing running stretches at the nurse's station. So they're
it is orthopedics.
Well, they're living, they're walking their talk, and that's super amazing too. So I think we're lucky to have them, and I had a great experience. I wouldn't change one thing, not one thing.
That's cool.
So I'm going to be out of clinic until the beginning or middle of September. It's yet to be decided, and. And as a good patient, I'm my local PA, Carolyn, recommended I get protein supplements, so I'm taking those, and I'm taking vitamin C to keep from getting nerve problems as the nerves grow back. And even though I'm on absolutely no weight bearing until early October and I can't drive, I'm still trying to stay busy with my chickens. I've done inspections of my hives with my bee suit on, on my little knee scooter.
So you can still do those things at home with your
I
scooter.
can go cross country. There are knee scooters actually have big fat tires, and I'm thinking of getting one because I'm going to need to chase chickens. And although my dog is a little worried I'm going to run over her toes, that hasn't happened yet.
Oh, well, that's good.
Yeah.
So you're not a crazy woman driver out there on your little knee scooter?
I am sometimes. I mean, sometimes you can really get the speed going, and it's like being 7 again on that bike. You know?
We're definitely going to the pump track.
It's a watch this, Mom, watch this. You know? my when I started to get a little wild, my kids brought me back in. But I may be old, but I'm not going quietly. That's what I'm saying. So that was my experience as a patient. Luckily, I had good resources. I've had great people all around, coastside and, inland. And I appreciate their good care more than they will ever imagine, because it is so different than here. It's not bad here. It's just different. And I think I'm looking at maybe the face of medicine. I hope a place like this could fit in well with universal health care, although I don't know how their providers would feel about it. And I especially taken with the cast technician. So all you MAs out there who are not particularly feeling the love of rooming patients and running around when your provider's issuing orders, there's little niche things that you can be trained at. And she had her own little office, and she knew what she was doing, and she did a great job. So,
Wow.
yeah, I'd do it all over again, although, this non-weight bearing sucks.
I was going to say, why?
Yeah.
That must be a really cool cast technician if you'd have surgery again just to hang out with her.
Yeah, she's cool. Well, all the colors. I want a different color cast this time, and they've got like eight or 9 colors of cast.
Isn't that right? They were just generic when we were younger and plaster. And is it itchy?
Not yet.
No?
No.
You're not shoving a hanger down there and ripping up your skin and...
Well, no, I'm not allowed to do that. So she gave me important information, like, you don't do that. Because
No,
you're going
you're
to tear
not.
up your skin.
Get an infection and stink
Yeah,
really bad.
Get a hairdryer, put it on medium force and coolish to warm, and dry the moisture in there that's causing the itch. And that's been like,
Whoa, really?
whoa, I know, mind blown. See, they tell you stuff like that. That's why I was so impressed, because I'm going in there. I know about the study that vitamin C helps the regrowth of nerves. So
Yeah, I didn't know about that. Nobody told me.
You don't get peripheral neuropathies with chronic pain issues. And I'm like, of course you've read the study, and they're going, yeah, it's in the handout. So they are on top of the latest stuff. It was really great.
That is cool, because you're on top of everything. So if you were impressed by them, they must be that impressive.
No, I couldn't throw them a curveball that they hadn't heard about yet.
So we need to send them flowers and tell them thank you for taking such good care of you?
I don't know if we need to send them flowers, but I think we should have a new appreciation for how hard our healthcare providers and their staff work for us, even here.
Yeah, that is true.
Yeah.
Especially here, I would think, with not having all the bells and whistles and finding solutions for the things. And, and I understand what you were saying about, we can't do that. We can't do that. It's not that they don't want to, they don't have the ability. So that they still show up for work, and that you've done all of the amazing things that you've done in the community with such little resources. So thank you. And thank you to all of our providers here.
Yeah.
I appreciate it.
Absolutely.
Well, thank you so much, Lynn, for being here, for being a great patient. I would definitely like to go down to the pump track now if you're ready.
I know.
All right, let's do that.
Let's do it.
If you would like to listen to this episode again, or any episode of Health Matters with PA Lynn, you can always go to the KFUG YouTube channel, slide over the bar at the top where it says videos, popular, older, and get to the playlist side, scroll down, select Health Matters, and listen to 7 years worth of Lynn shows and pick the topics. I think you have 166 videos.
Holy cow.
170. Some of them have over 1,000 views.
Whoa.
Yeah, you're very popular. The service you provide is amazing, so I appreciate it. So thank you.
Well, I appreciate having my little soapbox. So.
Thanks, Lynn.
Alrighty.